I really think we need to get you into hospital. My worry is that this is just going to get worse and worse and worse. You might not survive it.
On the outside, I look okay. But inside, actually, I'm not so good. It's just like a mask, really.
Okay.
Haven't had any unexplained weight loss or anything like that?
Since September last year, I've lost about 2.5 stone.
Without trying at all?
Sometimes she has rice and chips.
You're going to be Mummy's little truth demon on her shoulder. And what kind of things do you like to have?
McDonald's.
We're definitely living in an era where people have never been more worried about their health.
The demand for general practice has increased enormously. Post the COVID pandemic, general practice has pushed probably more to its limits than ever before.
Morning, Alex. How are you? Coming to Swindon to work in the mobile GP surgery, you really want to help in any possible way.
Wherever you work in the country, the one thing that rings true is that you're all there for each other.
Good morning, GP's mobile surgery. Ellie speaking.
What's the purpose of it then?
Take a little bit of strain off of the GPs because we bring in the cabins, which is our own surgery, and we come with our locum GPs, and so it's just to help them out a little bit because obviously they're so snowed under with patients and everything.
Hiya, Grace.
Hello,
Hi, I'm Dr.
hi.
Khan. Come
Hello,
through. Looking very summery today.
Oh, thank you.
Come and sit down.
Thank you.
How are you?
I'm good. How are you?
Yeah, very well, thanks, Ryan. Nobody ever asked the doctor that, so it's very nice. Thank you very much for asking. I'm very well.
Yeah.
How can I help today?
I've been getting like a hot flash every single day. Sometimes at home, it's like I put the fan on and then another minute I'm cold and I just had to close the windows and everything. And then nighttime I sweat a lot.
Okay. When you have these sweats at night, do you ever have to wake up and change your clothes or change the bed sheets?
Yes, I had to wake up and change my clothes.
Okay,
yeah, and then
I was looking through your notes before you came in, and I can see you had an emergency hysterectomy
I did,
after
yeah.
the birth of one of your children.
Yeah.
Just talk me through what happened there.
Yeah, my fourth child, I've got 4 children, so my fourth one, what happened was the placenta got stuck in the uterus.
Okay.
So, and I was bleeding a lot. I lost like 2 liters of blood.
Okay.
So emergently they had to said, oh, we have to take it out. And I was like, no, but it was an emergency just to save me and a child. So
yeah. Do you know if they took your ovaries as well?
I'm not sure. I'm waiting for them to get back to me what they have taken.
It's just because if they have taken your ovaries, then that will put you into an early menopause.
Yeah.
Hello. Hello. Are you here to see Debbie?
Yes.
Is that correct? Amazing, brilliant. If you'd both like to just take a seat, she won't be too long.
Thank you.
Right? Yeah. I like your hat, that's very smart.
Thank you.
Is it new?
No, I've had this one for quite a while.
This one, yeah.
This one, oh, have we got quite the collection going on?
Yeah, say that, yeah. You do like them, don't you?
Yeah.
I'm not an artist, but I'll do my best. This is your uterus here, and the baby will have been in there. Now, all your sex hormones, so your estrogen and all of that stuff, is all governed by these ovaries. When your baby came out, you said the placenta was stuck, and so if they couldn't stop that bleeding, they've done a hysterectomy. Now, a partial hysterectomy is just taking the uterus out there. If they did a total hysterectomy, they will have taken the ovaries out as well.
Yeah.
Because if they've taken your ovaries out, one of the main symptoms of the menopause is hot flushes and night sweats and that kind of thing, so that would explain it. And then we can talk about replacing those hormones.
Okay.
And that's easily done. However, if they've left your ovaries in, we have to look for other causes of these night sweats and hot feelings that you're having. I mean, the things we have to think about, is there something like TB going on?
Okay.
Then we've got lymphomas and leukemias. I don't think that's the case because you look very well. But my feeling is the first port of call for you is to find out whether you've still got your ovaries.
Okay.
And I think we might need to scan your tummy to have a look to see whether they're.
Yeah.
I want to do some tests on you for some of these other things as well, if that's okay.
Yes, please, yeah.
We want to get your symptoms sorted so you can go back to leading a normal, you know, have a nice night's sleep at least.
Definitely. That's lovely. Thank you so much.
Thank you very much, Grace.
Have a good day.
You too.
Bye.
Take care. Bye-bye.
Hi there.
Hiya.
Are you Oscar?
Yes.
In you come, my love. Hi there, my name's Debbie. I'm a nurse practitioner. Who's this lovely lady then?
My mum.
Your mum. Is she a good one?
Yes.
Oh, that's nice. Well, let's stay then, eh? What can I do for you today? Do you want your mum to talk or do you want to talk?
OK, so Oscar has an inverted chest.
Yeah.
Oscar tells me that when he's at school, he struggles with his activities. So he's got something called the mugger, which is like the size of a tennis court. And when he goes halfway round it, he's out of breath and he struggles. So
I do get out of breath, but I can still keep going. But I still get out of breath.
So I don't know whether there's anything worth looking into, whether he's got asthma.
So we'll have a little look at your chest. So have you got a pectus excavatum? Is that what it's called?
He's got, yeah. You want to tell the lady how you feel?
I get really, really nervous when somebody asks me to take off my top.
Has anybody teased you about it or anything, or?
I think it was one time when we were at Splashdown, these boys started laughing at me. And they wouldn't say physically, they were just laughing because they were behind us, and it made me...
Didn't make you feel funny?
Yeah.
Sometimes when people see things that are different, they do laugh, don't they? But it's not nice, is it? I don't think people don't understand the effect that can have on you. It's hard, but it might be for you to think about this is different, but not in a bad way.
And that's what I say. It's Oscar. This is who you are, isn't it? Yeah.
Because I'm a children's nurse and I've looked after children all my life, and I've seen this in loads and loads of children. You've had a bad experience and that's really upset you. Do you want me to have a look at your chest or not? You don't. You don't mind? Come on, let's have a look.
We might as well, you're here.
Yeah, let's have a look. Oh, that's fine. Yeah, when he showed me his chest, I did feel really emotional because it was such a big, big thing for him.
I know it's normal for me, but I still just get anxiety about it. Worried about it.
But do you know, I think you're so sensible, and for a little boy who's not even 11, for you to be able to show me that, that's great.
That was the first time, even when we went to the consultation in Oxford, he wouldn't do it.
Really?
Nope.
Oh, well, little beauty. It is really satisfying and makes you feel really good if a child does open up to you and you really feel that you're making a difference with them. And that is really special. It's one of the parts of the job that I love. When you're young, it's nice to be just like everybody else, isn't it? But as you get a bit older, well, I think it's a bit nice to be a bit different, don't you, Mum?
I do think so. No one's the same. Everybody's different.
Everybody's different.
Yeah. Whether it's from the inside or the outside.
Yeah. Like you did that for me today. When you get home tonight, get your shirt off in front of that mirror. Say, look at me, this is my pectus excavatum. Ah, gorgeous.
What? No cushion?
Well, I'll tell them to up their game, Mrs. Mead.
Right.
How are you?
Do you feel tired or do you feel OK? I heard you out there saying you're a golfer. You play a lot of golf.
Yeah, I'm tired after golf, but I'm 78. So.
Yeah, you're 78, aren't you? Yeah.
The most satisfying thing about being a GP is talking to people.
See that you've got your stick with you today. Again, is that a new feature? Or was that
It's a brand new feature.
A brand new feature.
It's actually my wife's.
When you're lucky enough to sit down with...
There you go, brilliant.
Like a 90-year-old who's just had this incredible life. The things you learn are fascinating. The people you meet are inspiring.
I've worked for the Ministry of Defence.
Oh, wow,
in
okay.
Gibraltar, in an overseas posting for 40 years.
3 weeks ago, and I fell straight on my backside.
It is the best job in the world, without a shadow of a doubt. There aren't many jobs out there that are this rewarding.
So have you got much on for the rest of the day?
I should go and have my dinner, then I've got the chiropodist coming, so...
You've got the what coming?
The chiropodist.
Oh, lovely. Right, you don't get them painted, you don't get anything...
No, I'm not.
Nothing fancy.
I'm 94, love.
You're 94?
Yes.
Hello there. Here he is. Nice to meet you. My name's Dr. Savage. Are you Mrs. Wicker?
Yes.
Would you like to come through?
Yeah.
Do you need a hand?
No, I got my stick. It's my trusty stick.
What brings you here today?
My feet.
Your feet?
For about a month, I've not had any sleep with the itch. The only thing that helps is to sit with my feet in a bowl of water. And when I get to bed and put my legs up, it starts and the feet swell and the itching gets worse and worse. And I've got very, very dry skin there now, and little blisters on it.
I'm sorry that that's been troubling you for so long.
It's been awful,
and not
yeah.
getting any sleep is pretty rotten. So, yeah, we definitely want to try and get on top of it. Let's have a good look at what's going on. Oh, yeah. That does look really sore.
I haven't got any fat on the sole of my feet either, so that makes it worse. I'm walking on bone.
Got great pulses. The blood flow is good. So you're just putting cold water on it. Is that all you're doing?
Just put my feet in cold water.
The reason I don't like that is, although it may be giving you a bit of relief, just water tends to dry your skin out a little bit more. It could even make things worse. I think you've got a type of varicose eczema, actually, because there's a lot of, even though the blood flow is really good, we're not doing so well at getting the fluid back up. But I think you've had Pomphyllox, which is a very, very extreme form of eczema, severe eczema, very itchy, and you need something stronger than this. You need a more potent steroid, I think, to get on top of it. I would probably add a little bit of antifungal. If there is a little bit of fungus lurking in between the toes, I don't want that to get out of control. And I also want to give you a big tub of moisturiser, keep it in the fridge.
Yeah.
So whenever you're feeling like it's really, really itchy, you get out of the fridge and you lather that over your feet. Yes. That'll give you the soothing, cooling effect of the water, but without drying it out. Is that a lot of information, or is that? It sounds like you've got it all.
No, not at all. No, and is that going to cure me?
Yes, I think it will. Okay, I like to back myself.
Can I have a listen to your chest? Is that all right? If you breathe in and out for me. Okay. Lovely. You can sit back down now. Finger in there. That'll just tell me your oxygen in your blood. That's perfect. Right. So there's a couple of things. If you're feeling a little bit short of breath sometime, it is important that you tell us. So that's really good. It sounds like you've got exercise-induced shortness of breath, because you're not short of breath at any other time, and you can't test for asthma really. The spirometry you had has shown that your lung function is perfect. Okay. Yeah, and that's the best test for your lung function. Your chest turning in is not putting any pressure on your lungs. So there's two things we can do. One thing is testing peak flows, and the other thing we can do, which might be a good idea, is we could give you a trial of it's called a salbutamol inhaler. It's called a reliever. So what happens is you puff it in and it opens up your airways, and it works really quickly. You can do it before you're doing your running. I want you to get a little notebook and you write down when you take it, how much you take, and whether you were better afterwards. Okay, that's fine. And then I want you to go to reception in 3 to 4 weeks' time to book a review with the asthma nurse. Okay, and take that with you. Yeah, perfect. Right. Is that okay? Yeah. Keep up the good work.
Thank you very much.
Okay, all the
Cheers.
best.
Thank you.
Okay,
Bye-bye.
see you later. Bye-bye.
Bye-bye. Bye.
Okay?
Yeah.
Does she make you understand a little bit better?
Yeah.
So what causes it?
This is a bit of bad luck, and also the fact the circulation coming back up isn't perfect because those varicose veins, that's contributing to it.
I said I'm wearing out. I'm 94.
I was pretty impressed. I thought there was something going on with the computer. I was thinking, how can you be on so few medications and had so? I know you had the pacemaker going. I was pleased to see that was checked. But looking through your record, you're doing amazing. Yeah, but these sorts of things have bigger impact than we give all the credit to these big headline conditions. But actually, the sort of thing that really gets you down is not being able to sleep. Have you ever seen a podiatrist? No. Because there's little insoles and supports you can get with different types of footwear. Oh yes,
I have. I've got a chiropodist coming this afternoon.
Okay,
actually.
Wonderful. Well, why don't you talk to them and see if they've got any stuff you can do to sort of put in your shoes to make sure.
And
the
I
weight's
have my
nicely
shoes
distributed.
made because I had polio when I was young.
Wow.
Because of muscles and all the rest of it. So I do have my shoes made, and they've got built-in things on the inside and everything.
Wow. My granny is 102, and she had polio. She was in an iron lung for 2 years.
She?
Yeah, just after she just got married, war had ended, was pregnant with her first child and got polio and was paralysed for 2 years and was in an iron lung. Maybe that if you survive polio, maybe you have to be extremely robust to survive polio in the first instance, and that's why you guys are doing so well.
She's 102.
Yeah, she's remarkable. I hope my granny doesn't mind me talking about her. There isn't a sort of grandmother-grandson confidentiality clause that I've breached, but... All right.
Yeah, I don't see you very well.
Lovely to meet you.
Thank you. Well, thank you ever so much for your time.
That's all right.
Listening to you talk about back pain, I was like, my back is hurting.
I think the job of a physio mostly is to tell people they're going to get better, mostly.
That's nice.
Yeah.
Yeah.
It's the really positive bit of healthcare. Yeah, she's good, she's fixable. Yay. That's why
great.
I chose physio.
Hello. How are you?
I'm here to see the physio.
What's your name?
It's Chloe Pickford.
Chloe Pickford. That's great if you just want to take a seat there.
Thank you.
Been up to anything nice this morning?
No.
No.
I can't really do anything because my knee's really sore.
Oh. What did you do to it?
I work with horses, so I got kicked in the knee and it's really sore.
That's why horses scare me so much. Are you like scared of them now, or are you still?
No, I ride for Britain, so that's what I...
Oh, wow.
Yeah. So this, to me, is a bit annoying, really, but you've got to live with it, haven't you?
Come through, Chloe. I'm Emma. Hi.
Thank you.
I am the physio. So, you like to have a seat for me for a minute?
Yes.
Is sitting comfortable? Yeah. So talk me through what's happened to your knee.
So I was trying to catch a horse and he kicked me in the knee.
You don't hear that every day?
No.
Okay.
I work with horses for a job.
You were chasing him. Okay.
And he just...
It's his back leg?
Yeah.
Straight up
just
behind
caught me
you.
in the knee. And since then, it's been quite swollen and it's almost like I can hear crunching and grinding when I walk.
So was it a kick from the side or was it directly onto your kneecap?
Directly in
like
the knee.
straight into your kneecap. And how long ago was that?
That was on Saturday evening.
Okay, so you've had 2 days.
Yeah. Been trying to ice it and rest it, but it just doesn't seem to be getting any better.
So if I may, we're going to see both knees, if that's all right, Chloe. Thank you. Can you put your hand on exactly where you feel it?
It's around here.
Okay. So right in the front, and that's exactly where the horse kicked you. So was it actually on your kneecap itself? Okay, gently relax that knee for me. Yeah, it's really sore in there. Can you show me what you can do on the bad side?
I think that's about
as far as you can go. And then is it the crunchy pain that stops you again? If I get you just to stand for me, can I see what happens to your kneecap just when you're stood up? Would you be able to stand on one leg still, do you think? Have you tried that?
I've tried it, but it's almost...
Is that too painful?
Yeah.
Okay, I think because the horse kicked you actually on your kneecap, and because it's completely constant pain day and night, I think that probably the best thing to do is to get it x-rayed, just to make sure that the horse didn't cause a fracture in your kneecap. Would you be able to go later on today?
Yes, that's fine.
Yeah, and then I will call you as soon as that x-ray's back. Okay, all right then, thank you so much.
Thank you. Thanks,
Chloe. Thank you. Right, I'm just going to have a quick chat with the duty doctor about that one. So. She was like, yeah, a horse, literally, she was running, the horse was running, the horse did that bang, and you could literally feel the crepitus like in her kneecap, constant and remitting day and night. It happened on Saturday, hasn't been to A&E. Like you could, do you know when it's proper?
Horrible.
Yeah, she's gone up to A&E now, but I've put her on the list as well, so she's hopefully.
Are you here all day or just this morning?
Yes. I've literally rammed until 5 o'clock.
Morning.
She'll be seeing Dr. Beecraft. Just take a seat here and she'll be out for you shortly.
Mr. Francis, hi, come on back in. Come and have a seat. How are you? So where are we at with this?
I'm still bringing up loads of grey green gunk.
Okay.
And it's getting worse at night.
Okay. We put you back on the steroids, and has that made any difference in going back on those?
A little bit, but the voice is now going as well.
Jonathan has chronic obstructive pulmonary disease, or COPD for short. This is a chronic lung condition and it can cause flare-ups where someone can become acutely short of breath and unwell. The plan was to go to hospital. That didn't happen.
We've now got, as we said, we've now purchased a nebuliser now, so I've got one indoors now.
So what are you doing with that?
I don't know, till we get somebody prescribe me the
and so
ampules. I know how to use
what
them.
made you have choose to buy the nebuliser?
It's to do with what happened in hospital.
Tell me a little bit about what happened in hospital.
My wife's father passed away there.
When was that?
March.
Back in March. And since then, you've not wanted to go back? Okay, so that's stopping you wanting to go. Okay, so what do we do about that?
Well, with the use of a nebuliser, I've got one now, so I can see how I can go with that.
Because that's not all that you would have in hospital.
No, it'd be antibiotics.
Antibiotics and maybe some oxygen and essentially the monitoring is the issue, isn't it? So it's one part of it's having the drugs, but the other part of it's having the doctors, the nurses, the physios, all the rest of it. That is what will make you get better, not just having the machine.
There's also the risk at the moment as well, is just different variations of COVID and so forth. I don't want to go in sick and come out sicker.
Although the breathing is the issue why you're here, the longer this goes on, the more effort and the more strain that this is putting on your heart. And the problem we have is that we run the risk of it suddenly stopping when you're at home with your partner. And what would they do then?
Panic.
Right, we'll have a quick look at it. I'll just wash my hands, I'll have a cough.
A couple of days later to get a cough. Weirdly enough, for 2 days it disappeared and then came back. Right.
So there's a cough. There's that cough thing which is annoying.
Just take a cough for me.
He's had a sort of cough and a cold for about 3 weeks. The cough isn't seeming to go and it sounds very, very chesty.
Here to here. Like that.
Just this all the time?
Yeah.
Okay, let's have a little look and a listen and see where we're at with things today. Nice big breaths for me. Well done. Okay, pop your finger in there for me. Let's see what we're doing with that now. Okay. I'm quite concerned. When I listen to your chest, it's just noisy and wheezy everywhere. Your oxygen levels are still on the lower side, and actually what's quite important is that your pulse rate's quite high. To try and get the oxygen around your body, your heart is beating faster and faster and faster. But there is so much that can manage, kind of thing, and then it just stops. Okay, and then we're in real trouble. I really think we need to get you into hospital to get this better. My worry is that this is just going to get worse and worse and worse, and ultimately could be really serious. You might not survive it.
Yeah, that I still run the risk of going, do I get something while I'm there as well?
My feeling is that the risk of you staying at home is much, much higher, and you actually having something that could be fatal, rather than going into hospital and potentially picking up something else. But I think that risk is probably lower. Have you had your COVID vaccines and things? Yeah. I think I just need to call you an ambulance now.
Okay.
So stay there for a moment.
You are through to Southwestern Ambulance Service is currently operating under extreme pressure and there will be a delay in answering.
Yeah, so I'm a GP. He's got a really severe exacerbation of COPD. He needs to be admitted. Pretty soonish, but yeah. 3.
It's just us 3.
How would you say you're feeling today with your mood? How would you describe your mood to me?
Pretty low.
You're feeling pretty low today. Okay. How long have you noticed that's been changed for?
Probably the last couple of months.
Okay.
Which is when, you know, I sort of thought, I don't feel myself. I could feel myself going. And it scares me because I don't want to go back to how it was a long time ago.
So when you had the accident, is that right?
Yeah.
I know, was that 18 years ago?
Yeah.
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 Okay. And that's where you noticed your mood started to decline.
That's where I went into, you know, bereavement and then went into the depression mode, and I'm not going to say I've been there for 18 years, but yeah.
Mari has been on citalopram for 15 years following an accident and sadly losing her husband at a very young age, and is finding that she's just not feeling any benefit from it anymore.
But you know how you feel at your worst and you don't want to get back there again, and we absolutely don't want that to happen. So, and I guess in the last 18 years there's been times where the citalopram that you've been on for that long has helped and kept you quite stable, but sometimes it can stop working as well.
Yeah.
Sometimes with antidepressants you can develop a tolerance to that in your body and they can no longer be effective. So this was probably a good point for us to discuss making changes to her antidepressants.
So your body's used to it. So coming off of it is going to obviously just make you feel a bit strange. But it's only short term. We talked the other day about you starting on fluoxetine. Okay, we'd start you on 20 milligrams and then we would review until we get you on a stable dose.
Okay,
and then hopefully you'll start to feel a little bit better. Okay.
Yeah.
But alongside that, I would highly recommend that you engage in some therapy or some counselling just to talk through obviously what happened and how much stress that's caused you. Just remind me, have you had therapy before?
Yeah.
You have, and how did you find that?
Not relevant to me. Bereavement group was quite good, but I was the youngest there.
Okay.
But when you've been widowed at 33...
That's very young, isn't it?
It's not a taboo subject, but the people don't seem to understand that there are younger women that do get widowed also, but everything's geared for an older person. Which, you know, some of the ideas they came up with really weren't relevant for me or anything.
Thanks so much. Okay, bye. Okay. So the ambulance is going to come. I'll come down to the main building with you and we'll go from there. Okay. As doctors, we can only really advise our patients. We can't make them take medication or do a certain thing that we would recommend. And it can be really difficult because you have to try and persuade your patient that what you're suggesting is the right thing to do. Okay?
Just right tight.
Yeah.
It's getting sore now.
I wanted to be respectful of his concerns about being in hospital, but I also needed to know that he understood that if he didn't go, that he would potentially deteriorate much more quickly at home and that could potentially be fatal.
As you're aware, it can take 4 to 6 weeks for antidepressants to settle into your system. It's a bit of a journey.
Yeah, and it's not an instant fix. I think some people think it's an instant thing to fix, not necessarily fix, but deal with, and it's not. It is trial and error, unfortunately.
Yeah, and I think that's why people need to know that they've got someone walking alongside them.
Yeah, no, definitely. You know, I've got my girls, and you know, they're really good, but they're grown up, got their own families, and you know, I don't think I should burden them. You know?
I know you mentioned that to me before, but what are you worried about by telling them how you're feeling?
To admit that I'm struggling still 18 years later. And
go, sweetheart.
Oh, thanks. And you know, on the outside I look okay and I have a laugh and do whatever, but inside actually I'm not so good.
Okay.
And it's admitting that admitting to myself as well that it's just like a mask, really.
Okay. And I think probably if if they knew how you were feeling, they would want to help and support you.
But it's just hard as a parent to sort of ask your children for help when it should be the other way around.
I understand that. But I think when you're a part of a family and you all love each other and want to support each other, sometimes those roles have to change. But it's up to you. You've got friends you can talk to?
Yeah, I have, yeah.
Okay. Are your friends aware of how bad you're feeling?
Yeah, they're very close friends.
Good.
Yeah.
Okay, as long as somebody is and you're not dealing with this on your own. But you're not alone.
No, which is nice.
Yeah,
yeah,
absolutely not.
Yeah, depression is just a lot more acceptable now than what it used to be.
Yeah, it's not so taboo anymore, is it?
And knowing that the help's there for me is such a it's just great, really.
So let's follow our plan and we'll do it together.
Yeah, thank you.
Lovely.
That's great.
Lovely to meet you.
Yep, you too.
And I will speak to you next week.
Yep, okay, that's great. Yep.
Come on, love it.
Thank
Take
you.
care.
And you. Bye.
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 Hello.
Hiya. Are you alright?
Yeah, good, thank you.
Brilliant. Are you here to see Dr. Sam?
Dr. Sam, yes.
Brilliant.
Yeah.
If you'd like to take a seat,
Thank
that would
you.
be brilliant. It won't be too long.
No worries. Have you been up to much today so far?
No, just a school holiday, so the kids...
Oh, lovely. Oh,
say lovely.
Exhausting, I bet. How many have you got?
Three.
Okay, house full.
Yeah.
What have you been up to?
So my parents are moving in a few
Hello,
weeks'
is that
time.
Rebecca?
Yes. Hiya.
Lovely to meet you. My name's
And
Sam.
you.
I'm one of the GPs here today. Please come and take a seat. Thanks for coming in.
Thank you.
What brings you here today?
So a few weeks ago, I went to the pharmacist, my local pharmacist, because I had like a rash. It started on my bottom and then went down my legs, up my back, and he gave me strong antihistamines, some cream. It wasn't any better than like 3 days later, so I went back to the doctors. They said it sort of was like some sort of fungal infection, but she wasn't 100% sure. It then got to the point where I was covered in bruises. So this was last week. All my arms, my belly, my legs, everything was covered in bruises. So they did some blood tests. They've come back normal, but he recommended that I doubled, if not tripled, the strong antihistamines that I was on to try and reduce my histamine level to stop me from itching. I ran out of those yesterday and it's flared straight back up again. I've not changed anything. I've been racking my brains thinking, what have I changed? Absolutely nothing.
Any swollen glands or anything like that? Or
My gland here has been up probably for 2-3 months. I don't know whether that's just because run down or whatever. I don't know.
just look up Jim a little bit. No swollen glands in your armpits or anything like that?
Not that I've noticed.
I'm not feeling any...
No.
All right, do you mind if I have a look at your skin? Yeah.
You can.
Yeah.
Yeah, no, my bottom is probably the worst. It's all broken skin. It's all started just like here, all around here.
Do you shave your legs or your buttocks or anything
No,
like
nothing
that?
like that, no.
Bring that down for a sec.
Yeah.
Okay, that's fine. And so this is 5 weeks now, would you say? Other than this bad few weeks with the skin, otherwise your health's been fine?
Fine, yeah.
Haven't had any unexplained weight loss or anything like that?
I've been losing weight. I have been losing weight, not really trying, although I probably should. I haven't really tried, and I sort of stood on the scales every few weeks, and it's been sort of two pound loss every week.
So how much weight have you lost in the last few months?
In the last few months, probably half a stone, if not a little bit more, but in the last sort of since September last year, I've lost about 2.5 stone.
Without trying at all?
Yeah.
Okay. Things that I don't like are the fact that you've lost so much weight.
Yeah.
If you're telling me that you aren't suddenly stressed out of your mind, or
No,
you
not
haven't
like-
suddenly
no.
done a crash diet,
No.
to lose 2.5
Yeah.
stone,
Yeah.
I don't know
Yeah.
where that's coming
Yeah.
from.
Yeah.
And we need to find an answer
Yeah.
to that.
Mm.
Now, the fact that you've had really quite extensive blood tests done,
Yes.
which are perfect.
Yes.
So that's reassuring. But
Yes.
I've also got a few things at the back of my mind I can't explain. I don't
Yeah.
feel happy about
Yeah.
that. Your
No.
bowel habit's been fine?
Yeah, I mean, I have had some bleeding, like when I've
gone to the toilet, but I put that down to having piles since I had children, so I'm assuming that's...
Okay, how long's that been going on for?
On and off probably for like 6 months, maybe.
No change in that bowel habit? They haven't suddenly got really constipated or suddenly had loads of diarrhea?
Nothing like that. No.
Okay. What I'm going to do is, well, I'd like to do a back passage exam before you go as well, just for reassuring.
Yeah.
And I'll just get a chaperone. I'll get Debbie in to chaperone for me, if that's okay, and no one will come in. Debbie, I need a chaperone note. This lady's got, it doesn't look like a sort of worrying rash, but she's had 2.5 stone of weight loss unexplained over the year. And I don't know what's causing it, so yeah. Hi there.
Hiya.
So this is Debbie. Yeah, that's all good. When someone tells me they managed to lose a significant amount of weight without even trying, I'm always alert to some kind of medical pathology going on and the possibility of a bowel cancer. Just gently making sure there's nothing sinister in there at all. Well done, just breathe and relax as best you can. Sorry to prod and poke around. That's wonderful. Clean yourself up a bit.
Hey, Anna.
Thanks for that, Debs.
Pleasure.
You've got a bit more than you bargained for today.
You did really, didn't you?
Only going for antihistamines.
There you go.
Yeah, exactly. Okay, so that's all reassuring.
Good.
There's nothing sinister up there at all. Everything looks healthy.
Yeah.
One thing we didn't look at can cause pruritus, which is itching, and weight loss would be a thyroid function.
Okay. Yeah.
You don't have a swollen gland up
No.
here, but sometimes you would get swelling in your
Yeah.
neck. So I am going to do another blood test, organise that for you.
Perfect, thank you.
I don't want you to lose a lot of sleep about this.
No.
But we'll get things done
It's better to
urgently and
exclude it
then
than-
give you complete peace of
Yeah.
mind. The actual itching itself, I'll give you the antihistamines.
Yeah.
Because of how it looks today,
Yeah.
I'm going to also give you a short course of antibiotics.
Okay, thank
just
you.
because they look like they were some infected hair follicles and things like that.
Yeah.
Okay.
Amazing. You're a star. Thank you very much.
Nice
I really
to meet you.
appreciate it.
Best
Take
of luck.
care.
Take care.
Bye. Thank you.
Brilliant. Thank you
See
so much.
later.
Have a lovely day.
And you. Bye.
I'm on a low-carb diet at the moment.
Right,
believe it or
yeah.
not.
How's that going?
Okay.
Would you like to see a dietitian about that?
No, because I like my food.
All the doctor said was just to eat a lot more fibre. So Weetabix, I did eat a lot of Weetabix.
We've got some butternut squash, which are looking promising.
I love carrots, I love peas.
We've got spinach, kale, cabbages.
We eat a lot of salad.
So quite healthy things.
Well, if you're a rabbit, yeah.
So what's your downfall on what you eat, do you think?
I can't turn down a pizza.
Mrs. King. Hi, I'm Dr. Taylor. Hi. What's your name?
Matilda.
Hi, Matilda. In you come. Come with Mummy today.
Thank you.
Come in. I've just been having a read of the notes. Your blood results. So, the one thing that was slightly abnormal is that you're low in folic acid. Okay. You're not low in vitamin B12, so that is normal, but the folic acid is low, so that's certainly something we can replace with some dietary replacement. How is your diet, would you say?
Rubbish.
You're very honest. That's good.
It's
Being
not good
honest
at
is
all.
good.
Yeah.
So in terms of like green leaf vegetables?
Not much.
Right.
At all.
What about you, Matilda? How are you about eating vegetables?
No. I sometimes eat fruit with lunch.
Yeah, you're good at fruit, but we're not very good at vegetables in our house. I eat all the wrong things, to be fair.
What would a normal day's diet look like for you?
So I don't really eat breakfast. If I do, it's just a packet of crisps. Lunch at work is usually a ready meal. Jacket potato is like my go-to dinner.
Okay, that's a good.
Sometimes she has rice and chips.
You're going to be Mummy's little truth steaming on her shoulder. And what kind of things do you like to have?
Noodles and spaghetti.
Let's get you on taste.
McDonald's.
McDonald's for a treat now and then, okay? Yeah. Just as long as it's not all the time. So maybe it's worth thinking together how you could perhaps, because obviously, have you just got Matilda or have you got
We've got a little 7-month-old as well.
Oh, wow, okay.
So,
Weaning at the moment then?
Yeah.
So giving baby
Good
lots of
time.
fruit and vegetables.
Yes.
So maybe we need to think about ways to disguise them. So things like smoothies. So if she likes fruit and you like fruit, could you be putting some green leaf vegetable into a smoothie? The other thing that was a little bit abnormal, so one of your liver function tests, the ALT, was a little bit high. Not worryingly high, but it's just a little warning sign.
Okay.
Normally about a little bit of a fatty liver.
Okay, that's fine.
Oh, don't worry, sweetheart. It's nothing serious. Bless you.
It's okay.
You worried? Mummy's fine. She's fine. It's nice that you're giving her a cuddle, though. There's nothing to worry about. These are little things. As we get older and older, we do these tests, Matilda, just to kind of give us some advice as grown-ups, because sometimes grown-ups aren't so good at doing what they're supposed to do. Like, Mummy's being honest and saying she should eat better, and she wants you to eat good things, so she needs to eat good things too, doesn't she?
But we were following Slim and Wild for a little bit, but once baby was here, Finn just...
Cool. You only had a baby 7 months ago, so, you know, be fair to yourself. And you know what it's like. Hormones take time to settle down again.
Yeah, I didn't carry the baby, so my wife carried. So,
oh, okay.
But yeah. So
still, the stress of having a baby.
He's still
eating through the night. And what about your wife? How is she with food?
A lot worse.
What do you call Mummy and Mummy?
Mama.
Mummy and Mama.
Mama and Mummy. Yeah. Lovely. So, does Mummy also eat naughty things sometimes?
She most of the time eats chippies or just chips and curry sauce with chicken nuggets.
So, Matilda, what you might perhaps would be good fun to do is do some cooking with Mama and Mummy.
Definitely.
To kind of all think about what you're putting in the ingredients and try and maybe get some new recipes to try, because that's the way to make vegetables and things more interesting, is to think of fun ways to do it. Yeah? All right. Does that sound okay? I think we have a plan, don't we? So your job is to help Mummy and Mama make some healthier recipes for you all, so they can lose some weight.
Okay.
Yeah?
We can do that together, can't we?
Do that together, that'll be really fun.
And then when you do football, I can run around with you.
Yeah, that's a good thing to aim for. Are you good at football? Wow.
Super good.
Are you? All right.
Yes, come on, it's Thank you.
Okay. All right, lovely to meet you both. Do take care.
See you soon. See you guys. Enjoy football.
We need to eat much healthier. Go with Mama first. Okay, I was just telling you.
Cheerio, it's been really nice to meet you, Frank.
No problem, bye-bye.
See you later.
Nice to see you.
Good, thank you very much.
Cheers,
Thank you. Bye-bye. Have a nice day.
That's been great. Yeah, thank you.
Cheers.
All right,
Take
thanks.
care.
Bye-bye.
All right, thank you, Doctor.
Oh, I'm a physio.
Physio, well, okay, sorry.
That's all right, I'm not offended.
I feel really lucky that I've worked in general practice. I think in health it's so important that we all remember how privileged we are. People tell us things they would never tell anybody else. They show us things they would never show anybody else. And the trust that patients have in us is amazing.
I always like to describe general practice as a specialism in generalism. We are specialists, but we're specialists in the whole person and in understanding the implications of illness, the implications of mental health, the implications of family life on the whole.
That's a very, very strong painkiller. How much do you take?
I max out the daily amount.
This stroke sounds very dramatic and it's changed your life, I imagine.
Entirely.
3.5 months ago, they found a cancerous lump.
What a shock for you.
It was awful.
The GPs are back on the road next Tuesday at 7, and if you or someone you know has concerns about any of the issues raised tonight, find organisations offering help and support at channel5.com/helplines. Next, in another brand new series, Pocket Pooch Maisie has a super-sized yap that needs to be tamed, and more dogs behaving very badly in just a moment.